Okay. Thank you. So if you'll allow me just to move along, because I know we're on time. And I'm going to try and keep to my time as best as possible. So as was mentioned, I'm Roxanne Saville. I'm the school counselor at Athlone School for the Blind. I'm also the admissions officer at Athlone School, which will the counselor at Pioneer School have the same type of portfolio that I do. So I'll be discussing inclusive education in comparison to specialized education. So Athlone School for the Blind, we are considered special schooling, so schooling for learners with visual impairment. And then, as Kosa mentioned, we have an inclusive education team that goes out into the different schools in our district. And then our school also has an outreach team. So that's where learners who are at a mainstream school, where they would like to access the mainstream education, but with certain assessment accommodations and concessions, then our team will go out and go and evaluate and see how they can be assisted, and also evaluate whether or not the child remains at the mainstream school or if we should have the conversation of perhaps special schooling. But I'll discuss all of that. Next slide, Vanya. So first we have to ask the question, what is inclusive education? So if we look at it, it's basically that all children in the same classroom, in the same school, and it means learning opportunities for the group. It's not just learners with disability, it's also learners who perhaps have different languages or different abilities, but all within one classroom. Okay? Historically, children with disability were excluded from education completely, and that is how most special schools were started. In Athlone, almost hundreds of years ago, they found blind children playing in the streets because there was no school for visually impaired children. Same with Pioneer. There were blind children out in the rural areas. Nobody wanted to teach those children. So then the NG Church in Worcester stepped in and gave the school and sponsored that. In Cape Town, the Anglican Church stepped in and supported it. And through that, it grew, and eventually the Department of Education stepped in, and that's how the special schooling began. So historically, learners with disability were excluded completely. They had no access to education. Then, I don't like to use the word, but we considered segregation, where there's special schooling and then there's mainstream schooling. So Athlone School is a special school. We are separate from the other schoolings. We have the same curriculum, but we kept separate. Then you have integration, where a school will have a special class for learners with disability. Perhaps there is a special ed class, and that class specifically has learners with Down syndrome or learning disabilities, but they don't necessarily have the same curriculum or access to the curriculum. And what inclusive education is asking for is learners with disability and able-bodied or mainstream learners in the same class doing the same work, okay, because we want to include them. Okay, so next one. So I'm not necessarily going to give you the history of how inclusive education came to be, but just know that the Department of Education has a policy called SIAS, that's Screening, Identification, Assessment and Support. That is what every school in South Africa, I think Mr. Dupree would have spoken about that yesterday, because he's a big proponent and a big backer of inclusive education. So there's a policy where learners who are differently abled or who need special accommodations, the SIAS policy and the SIAS pathway will be used for that. Okay, so we screen and we identify learners. The next one. Okay, so how do learners gain access to a special school? Okay, so if a child is at a mainstream school, the teacher will note, for example, I'll use Coulsom's name. So they'll note that Coulsom is having difficulty seeing the board, and they're noticing that, you know, perhaps if they give her work, she looks at the page very closely, or she's always squinting, or whatever the case is, you know, she's bumping into things. So then they will fill in the SNA1, that's the classroom intervention. Teacher has tried this, teacher has tried that, it hasn't worked. So then they will contact the district office, okay? And then the district office will discuss it. They'll have a meeting, and then they'll say, okay, let's start making application to a special school. Then we have our screening meeting at the school, so they'll send an application or an application for outreach, and we will evaluate the application, we'll call the parents in, we'll do assessments, we will have interviews, and then as a team, the school team and the district team will have a discussion on whether or not we're going to look at placement or at a special school, or if we're going to look at following an inclusion pathway. And following that, the director, Mr. Dupree, he will then approve whether or not there will be a placement at a special school or if there will be outreach given to a specific school. So basically it works school, district, head office, back to the school. Okay? So that's how that system works. This is where the doctors come in. Nicola and Vanya? Okay. So how do you gain access to Athlone School? So there's 3 starting points. One is the hospital, which is where the doctors and the ophthalmologic nurses, they will refer a learner to a school. They say, okay, now Vanya is visually impaired and we now need to look at special schooling. Or our school historically has gotten walk-ins, and then there's also mainstream schools will have noticed a learner is having visual problems. But all applications, whether hospital, walk-in, or mainstream, they need to first, the applications need to be sent to the district office. And it would be preferable the district office in which you reside. So the school districts are Metro South, Central, East, and we're in North. Okay? And then there's also Eden Karoo, which is where Pioneer, they service the rural areas. We call that side of the mountain. And then Athlone School for the Blind, we service learners on this side in the metro. And when we go as far as Fishhook, we go to Stellenbosch, we go as far as Paul sometimes. Yeah, so we go very far. Okay? So all referrals, hospital, walk-in, mainstream schools, they will go to the district office and they will follow the CS pathway. So they will fill in the applications. It's quite, I should have actually brought it, it's quite a thick pack that needs to be filled in, and there is a section for the doctors to fill in as well. Okay, and the application will go on the district database. It will be referred to Athlone School for the Blind. Our school will then have a school-based support team meeting where myself, physiotherapy, O&M, nursing, OT, we will sit with the teachers and we'll have a discussion and evaluate the application. And we'll set the date and call the family in, do our functional visual assessments, speak to the parents, get a medical history from the families as well. And then we will, on our level, have a discussion of, are we going to consider WADE for outreach or are we going to consider it for placement? Okay? Following that, we will have a placement meeting with our district and our head office. Our program manager is Jolene McCary, and she kind of sits in our meetings on behalf of Mr. Dupree because he cannot be in all our meetings. And from that meeting, we will decide whether or not we're going to do, our school will, if we're going to advocate for outreach or inclusive education or placement. And then, let's say 2 weeks after that, the family will be contacted to say, okay, you've been accepted at Athlone School for the Blind, or we're coming to the school and we're going to do an evaluation there. Okay? Yeah. Okay. So we need to look at what are the benefits of inclusive education and what are the benefits of specialized education or special education. So special education, it gives learners a community and it gives them a feeling of inclusion in a community. So it's sometimes difficult for visually impaired or hearing impaired people to access our hearing or our sighted communities. But when they are within the school for visually impaired or the school for the hearing impaired, it gives them a place to belong. Okay? So that's the first benefit. Inclusion in sports and culture. So there are actually sports that are specific for people who are visually impaired. There's go-ball, we do judo, there's many other games, dancing, all these different things, athletics, that our learners are involved in. They get the necessary support, because, I mean, not all schools have an occupational therapy, has a physiotherapist, has a counselor on site, so they get specialized support there. The teachers are qualified to teach Braille, because that's what we specialize in. Differentiated instruction. So again, learners get their needs met at their level, because that's what we're there for. And we're a resource center, so as I said, we have all these different services on site. But if we look at inclusive education, learners are able to retain their friends, because even though friends are sighted, they have access to their friends. They have increased social initiations and networking. They have a greater access to the greater community, so they're not isolated. Families are more integrated into the communities, greater opportunities for interactions, increased inclusion for future environments, and enhanced skills acquisition, and just generally greater access. And then let's look at factors that affect specialized education. So it can be quite isolating. There's a lack of integration. So most of you didn't know that there was such a school as a school for the blind. Who before coming today knew that there was something called Athlone School for the blind? Didn't know. The parents now. Most people don't know. I'm going to be honest, before I started working there, I didn't know.
It's scary.
I didn't know. But I didn't, yeah, but you at Athlone School. But before I started working there, I didn't know. I thought when I drove to my interview, I was supposed to go to Athlone, but then GPS was taking me to Bellville. Yeah. It was very confusing. I didn't know there's a school for the blind. Most people don't know that there are 2 schools for the blind in the Western Province. People just don't know about it. So we're quite isolated. There's also a big stigma around visually impaired people or specialized schooling. I don't want to send my child to the school for the blind. People are going to tease them or whatever the case is. There's still, even in today's age, there is still a lot of stigma attached to specialized education or even physically disabled people. Students with special needs may have problems relating to other children in other classes or other schools. So social relationships, that's also something that sometimes suffers. Academics, specialized education sometimes involves lowering expectations. I would just like to, on that point, learners at specialized schools or special schools, we use the exact same curriculum that mainstream uses. And to brag, Athlone School for the Blind in the NSC Matric of 2023, we were spot 1 and spot 3 nationally. So, I mean, we are on par with and above the other schools. Okay? And then transition to a regular school, some find it difficult to transition from a special school to a mainstream school. Okay? So that's just some of the challenges or things that affect specialized education. And then if we look at inclusive education, things that affect it, it's not always possible to remain in a mainstream school. It's all diagnosis dependent, okay? So sometimes it affects access to the mainstream curriculum. School orientation, some mainstream schools are a bit hesitant to have learners with special needs in their schools. We just need to be aware that a school can say no, but they're not willing to make these adaptations, and we just need to be aware of that. Socioeconomic factors. You are parents of visually impaired children, you know that the assistive devices are exceptionally expensive. And not all of our families can afford to buy a Braille one, no touch. It's 100,000 for one. A Perkins Braille is 24,000 rand. Not every family can afford to buy that. Okay? Integration into the school community in terms of sport and culture. Sometimes learners who are, for example, visually impaired are excluded from certain activities because they can't play rugby because it's a health risk for people with glaucoma or retinal detachment. So sometimes they can be quite isolated in a mainstream school. And then a factor affecting inclusive education is parents' attitudes towards education and disability. The OTs have been speaking about it all weekend. Sometimes the parents are not ready to receive the diagnosis and the prognosis of whatever that's going to mean. So sometimes we ourselves as parents need to look within ourselves to see, am I my child's biggest barrier? Okay? So sometimes inclusion can affect that. All right? And it's well known, all children can learn. WCED was taken to court, and we lost the case. All children, every child has the right to education. And that is what we are here to do. We are here to discuss and preach and promote inclusion and inclusion in the education. So every learner, it doesn't matter where they are academically, where they are cognitively, each child has the right to education. All right? And that's my, did I keep time? Good. Okay, and then I just want to mention, I've spoken to some families here. I know you're at mainstream schools, but please, if you would like Athlone School for the Blind, or if you're out in the rural area, if you would like Pioneer School to come to your school and do an assessment and see how we can assist your child in mainstream, it's a free service. We don't ask you a cent. We will come out and we will come and assist you and evaluate the classrooms and what adaptations perhaps can be done so your child can be included in the school. All right, and if there's any questions, I think there will be a question and answer time somewhere. Okay, thank you.